we're going to keep going, guys. This is a bit of a short one. I actually thought this would be a bigger story. I really did, because I think it's pretty huge. This is on Health New Zealand, Te Whatu Ora's website. Health New Zealand offers voluntary redundancy to some staff. Some points here. At this stage, the option of expressing interest in voluntary redundancy is available to employees who are, number one, employed under individual employment agreements, which are not in coverage of collective employment agreements, or in a role within coverage of the new PSA and specialist workers collective agreement, in a role with coverage of the PSA National Health Administration workers. So you've got specialist workers, administration workers, employed on an individual employment agreement with terms and conditions derived from the PSA PACS, so they are calling for redundancies. This off RNZ today. Health New Zealand is asking for voluntary redundancies from admin and advisory staff. So remember, we talked about this once before, and we were hearing about doctors having to do a bunch of their own booking. And I was like, can you imagine that $400 an hour specialist now having to make sure his calendar's up to date because some of the admin staff had gone? That's what we want to spend our tax money on. $400 an hour specialist, making sure his diary is up to date. From admin and advisory staff ahead of yet more looming job cuts at the cash-strapped agency. Well, we should always remember the only reason it's cash-strapped is that this government has chosen for it to be cash-strapped after giving away $14 billion in tax cuts and $3 billion in landlord refunds. In an email to staff on Wednesday that has been published on Te Whatu Ora's website, Chief Executive Margie Upper said to be sustainable, the public health system needed to live within its budgets. I think what that means is for my job, right, as a chief executive to be sustainable, I have to keep you within these budgets that this government has set, with are arbitrary because they could be more if they chose to be, just so we're getting that out there and getting it clear. That means we need to move towards being a more efficient organization, focusing our resources on the delivery of frontline healthcare, Upper said. It's now clear the initiatives already in place will not by themselves resolve the financial issue or ensure we have the right people in the right places. As staff costs accounted for the biggest chunk of expenditure, Te Whatu Ora needed to further review its size and structure as part of its reset, Upper wrote. Talking about what it would mean, we've got some response to this. The move comes as Te Whatu Ora continues to work through the previously announced restructuring to its commissioning team, which involves axing 268 roles. The total number of staff in commissioning has shrunk from 1,000 to 750 in the first round of restructuring to now 482. The Public Service Association labelled the offer of voluntary redundancy as rash and reckless, unfocused, and wide-ranging. According to the union, teams impacted include administrators, procurement and supply chain, information, analytics and research, policy and programs, as well as communications, finance, and HR. National Secretary Kerry Davis said losing hundreds of specialist staff to meet government-imposed spending cuts would further destabilize the public health system. Excuse me. Just as they did for other public services, the politicians targeted people working behind the scenes because they think they can get away with it, she said. But clinicians and are well aware patient care depends on administrators, IT support, and logistics workers. This workforce was under huge pressure due to the hiring freeze in health, Davies said. We're already hearing horrifying stories of 72-hour wait times. I saw a news item in one of the papers today. Someone waited at an A&E yesterday for 16 hours to get seen. 16 hours in A&E.
And then, what happened then, Pat?
I don't know. I just saw the headline. And then what happened?
Oh, she was referred back to her GP.
Oh, very good. And worse for mental health care, gouging at foundations of an already stretched to breaking system will mean people won't get the care they need. The New Zealand Nurses Organisation said the offer to take voluntary redundancy was, quote, in breach of the established consultation process. So, Chewy, I thought that would be a bigger story today. But no other agency seemed to pick it up. RNZ covered it very well, though. Yours, sir.
This lie that they're going to stick to, that the problem is that our health service can't stick within its budget. Like, that's the biggest problem. We're on the tail end of a global pandemic. We have a growing population,
Aging population
as well.
Yep.
We're having to import health staff. But then suddenly, with the change of a government, that's all irrelevant, and suddenly it's just because our health service is riddled with inefficiencies, which seem to be the people that do the bookings and shuffle the paper, but it's also going to blow back on nurses, clinicians, and specialists. One of the things that I saw pop up, and look, I'm going to bring it up because our mainstream media is happy to crawl Reddit for stories.
Yep.
So I'm going to do it as well. More lies from Health New Zealand. I work at a hospital in Auckland. Obviously, I'm not going to identify myself. Recently, one of the longest serving and most respected neurologists has not had his contract with Health New Zealand renewed for next year. I've heard that this decision was made in a back office in Wellington without consultation with the local neurology department. This is a massive blow to healthcare in the Auckland region, and understandably, many people are very upset.
Yeah,
So
wow.
this is one anecdotal story. Obviously, can't be verified for whatever reason, but I see no reason why someone would say all of this.
It doesn't sound far-fetched, does it?
No, it doesn't.
Yeah.
And I mean, we were talking about it before we went to air. It's not like you can pop down to your local polytech and just pick up a spare neurologist when you need one. You know, and then if it becomes a crisis and we desperately need to attract someone in short order because this stupid decision's been made and this neurologist who hasn't had his contract renewed goes to somewhere that wants him, we have to pay over the barrel to get someone quickly. It's just so short-sighted.
Yeah.
And I think when people are making these sort of rash, reckless, wide-ranging decisions at such short notice with such a big public service as our healthcare system,
Yeah.
it's us that's going to be paying the price. It's the people that are lining up in A&E. It's the people that have an issue that would require a skilled neurologist. Now they don't have one in that region. Now the wait list is even longer.
Yeah.
Is that issue something that is growing, worsening, becoming more expensive, potentially deadly?
Yeah.
No, but we've got to worry about the budgets, and we've got to worry about the tax cuts that we promised, and they are the only thing that isn't on the chopping block. That's where the value is.
The other thing is, it might not be that there's now no neurologist, but there might now be one instead of two. So that waiting line goes and doubles immediately. Kim says, I work in health. Admin staff are the glue. They coordinate and sort everything. When you don't have an admin person, everything falls apart. Admin pay is awfully low. Also, Rose says, I have a son working in one of those departments Pat just mentioned. Today, he said to me, if he's made redundant, then they've gone so deep, the system is fucked. I guess that means if they go all the way to her son, that's so deep into the system, then the system is broken. I won't say beyond repair, but, it's completely broken.
Well, that might be the aim. They want to gut the service so hard that the only way that can be solved is with an overseas private expert coming in to save the day, because we never perceived that this would become a cascading point of failure that this government has made. They have engineered this crisis.